So there's a passage from Corinthians, if I recall my vestigial Irish catechism correctly, that goes something along the lines of, when I was a child, I spoke as a child, I understood as a child, and I thought as a child. But when I became a man, I put away such childish things. In the case of drugs policy in Australia, these childish things are the insistence that one day Australia will be rendered entirely drug-free, despite all of the efforts until now and all of the evidence to the contrary. There are drugs being used in Australia. Nothing that has been suggested or attempted has altered that. And the insistence that prohibition might work one day, where it's never worked anywhere in the world at any stage of history, is akin to the magical thinking of my youngest expecting a unicorn for his birthday. Cool idea. Now let's chat about the reality. The reality is in the latest policy brief from Harm Reduction Australia, making a compelling, evidence-based case for transforming pill testing from a series of carefully labelled, isolated trials into a more permanent, nationally integrated public health staple. Despite the poorly informed criticisms of pill testing, or drug checking as it's called locally, as a process, it has delivered on every promise that it has ever made. This, it should be added, is on the equivalent of the smell of an oily rag. The overwhelming majority of money spent is actually given to law enforcement, with significant limitations on the key performance indicators against which that expenditure is being measured. Were there any accountability of those KPIs, Australia might have long abandoned the use of sniffer or passive alert dogs at music festivals, an intervention now long shown to cause more harm than good. And expensive? For the money being invested by a single state per annum in this useless, harmful intervention, the best part of an entire federal pill testing initiative might be rolled out. Testing drugs before they are consumed and sharing the results with consumers to help them reflect on the wisdom of their choices has worked around the world for decades. Frankly, unsurprisingly, has been shown unequivocally to work in Australia too. Disgracefully, it took a quarter of a century to establish here, partly as a consequence of these childlike arguments mounted by ill-informed opponents, but also, it has to be said, by the inertia of those with actual expertise, reliant upon the approval of such opponents for sanction and a crust. Fortunately, the timidity of these experts has been overcome by the weight of local evidence. Under the sanction of the ACT government and the guidance of Harm Reduction Australia, Pill Testing Australia has provided Australians with Australia's first and only independently evaluated pill testing trial, at first at festivals and then from a fixed site. We created the first ethical framework as to how we should conduct ourselves, and even published an open guideline as to how interested parties might approach commencing a pill testing service. The analytical team, under the guidance of Prof. Mal McLeod, provides the latest state-of-the-art analytical expertise to define not only the standard of technology that is required, but also the state of the debate internationally now a regular feature in characterizing and reporting novel drugs that have never been described elsewhere. And yet, despite these successes, these are the least important outcomes for pill testing. Our greatest success to date is to have demonstrated that against the immovable object that is a young person's devotion to experiment, sometimes with illicit drugs, we have found a force that can move them and to change their perception of what is wise and what is not. Who knew, curiously and bizarrely, that force turned out to be what their own generation thought might work, and not what older generations were simply throwing at a wall to see what might stick. The time has come to grow up in Australia and admit that we could be doing better. Young Australians, no matter how adventurous, deserve the very best of what we have to offer them. And currently, our tax dollar is not paying for that. A mature, truly evidence-based approach to the problems associated with the consumption of drugs looks very different to that which is being provided in most jurisdictions. Pill testing is only one innovation that can move us from the reactive, waiting for ambulances at the bottom of the cliff, to the far more proactive, building a fence at the top, as we have done so in every other field of medical endeavour.